Hello everybody, I'm Dr. Feigenbaum. I'm a specialist in dental sleep medicine. I'm honored to be here working with Holistic because they're an outfit that doesn't only look out for your dental well-being, but also your overall health. Let's see if I get this technology. So I'm going to talk about a little about sleep apnea. The actual term for sleep apnea is obstructive sleep apnea. There are other types of sleep apnea, but that's not, you don't need to be concerned about it. Basically what it means is we're partially or total collapsing of the airway. The airway is like a flexible tube that goes down from your mouth down to your lungs. And it's, as I say, flexible, and if something gets in the way, it obstructs, it closes off, and you don't breathe. So this is what happens when you have sleep apnea. An untreated sleep apnea patient can stop breathing hundreds of times during the sleep per hour, and can lead to the lack of oxygen, sleep fragmentation, and increased sympathetic tone. Now let me explain that. So basically, if you're not breathing, you're not getting oxygen. And this can affect a lot of things in your body, not just your head, but all the cells in your body. Sleep fragmentation basically means your sleep is being disturbed. And increased sympathetic tone means basically it's a fight or flight reaction. So basically what happens is like somebody's trying to suffocate you. They're putting their hand over your mouth, you cannot breathe, and so your body produces adrenaline. It's a flight. You know, it's just being scared. Okay? And this increases adrenaline, causes high blood pressure, causes cardiovascular events. So that's the importance of it. I just took this MRI of a skull, and basically just to show you how obstructive sleep apnea can affect the airway. So basically on this side you see a normal airway, this space here, the dark space. This is a case where the patient has obstructive sleep apnea. So you see how narrow it is. So you have a very narrow airway in sleep apnea. Sleep apnea also increases as we get older. So if you don't have sleep apnea at a certain age, in your 20s you don't have it, and you possibly could have it, your chances increase as you get older. Anybody can have sleep apnea at any age, even kids, even babies. But it is more predominant in older people. It is a huge problem in this country now, not only in this country, but all over the world. 1 out of 4 males, adult males, has sleep apnea. 1 out of 5 females. It's tremendously undiagnosed by physicians in this country. Usually you walk into a physician's office, you know, you may complain of high blood pressure, whatever the issue is, they'll give you a blood pressure medication, but they don't get to the root of the problem. Signs and symptoms of sleep apnea. Now, some of the signs you mostly see is persistent heavy snoring. Now, there's a trick and a caveat to this, because not everybody snores. You can have sleep apnea and don't even snore. It's possible. But most people do snore, and most people snore heavily. It's usually worse when you sleep on your back. It's just the nature of gravity. Everything falls back on the airway when you're laying on your back. So a lot of patients you'll see, like 60% of patients have what we call positional sleep apnea. Positional sleep apnea means it's just worse on your back, usually by 2 times as much. It's also worse when following alcohol late at night or sedatives. These are muscle relaxants, and also relax the muscles and help them fall back into the airway. Apneas can also be associated with limb movements. They're called periodic limb movements. This is seen during the sleep test. We don't have to be too concerned about that. Nocturia is a big issue. Nocturia means going to the bathroom when you're sleeping, getting up, going to the bathroom. A lot of people sleep the night through, that's great, but a lot of people get up during the night once, twice, 3 times, even more times. People sometimes think this is just because they're getting older. It's not necessarily the case. What happens is when you have sleep apnea, it produces an enzyme, ANP, and what this does, it promotes water excretion. So it makes you want to go to the bathroom more. So a lot of people men confuse it with a large prostate. They say, well, I have to get up and go to the bathroom 3 or 4 times, and think it's their prostate. It isn't. It's a sleep apnea. Nocturnal sweatings, sudden awakening, basically that's what an apnea is. You stop breathing and you awaken, gasping for air. And it doesn't necessarily have to be an apnea. An apnea is a total cessation of breathing. There's also something called a hypopnea, which is a partial cessation of breathing. So it's not only apneas are bad, hypopneas are bad too. If you're not getting a total complement of oxygen when you sleep, this is not good either. Obviously, accidents can happen with daytime tiredness, and there are issues with insomnia also. And insomnia, it's not only inability to fall asleep, it's inability to stay asleep. So a lot of people have these awakenings when they sleep. Daytime issues with sleep apnea. Okay, obviously daytime tiredness is a huge issue. You hear about all these accidents, and I mentioned, well, not this slide or another slide, but all these motor vehicle accidents, all these train accidents, all can be related to sleep apnea. Memory and concentration dysfunction. Again, we're talking about lack of sleep, lack of oxygen. Gastroesophageal reflux, which is basically acid reflux, is a common side effect of sleep apnea. Irritability, depression, chronic fatigue, all these things are also associated with sleep apnea.
Why is acid reflux so common?
That's a complicated, that's a complicated
That's why I asked.
question.
It's okay.
Yeah, that's really beyond the scope of this.
Part 2, all right.
Yeah, that's a part 2 discussion. But we see it in over, I'd say, 50% of sleep apnea patients. They have some degree of acid reflux. I'm sorry, that's a really complicated issue. Okay. It is a tremendous health problem in this country. 50 to 70 million Americans have chronic sleep problems which affect daytime functioning. 20% serious motor vehicle accidents are sleep-related. There's a Wisconsin cohort study, which started in 1988, which they follow a whole mess of patients throughout the years. And they found, especially with severe sleep apnea, it takes 6.7 years off your life. That's what they have found. And for lesser degrees of sleep apnea, lesser times, but it's a serious health consequence. There's about $3.4 billion in extra costs per year, 7 times increase in motor vehicle accidents, mostly because of daytime tiredness. Chernobyl, Exxon Valdez were all related to sleep incidences. Certain deaths of famous people, which I'll get into a little bit more later. Hypertension, we measured again, cardiovascular effects, basically the increased sympathetic tone, increase in adrenaline when you sleep. Okay, all these other things are fairly obvious. I don't want to get into all of them, but the major thing is cardiovascular incidences. This is the major problem, and this is what you see a lot of the deaths of people, movie stars and so forth, that have sleep apnea, especially in their sleep, because they're having these incidences. I just want to talk about sleep staging a little, because people think that when you go to sleep, you stay asleep, and you're just sleeping and it's constant. It isn't. You go through stages all night long. There's a light sleep, which we know is N1, which is basically the difference when you're just awake and sleep, just dozing off type of sleep. N2, which is basically when you spend most of the night sleeping. Then N3. N3 is kind of interesting because that's the restorative stage of sleep. So basically children have a large degree of this, and if we get older, we lose it. And then REM sleep, which is basically rapid eye movement. This is the dream state where you have those very clear dreams. And I don't want to get too much into this. So I also want to mention a little about pediatric screening. If you guys have kids or you have families that have kids, again, early intervention is vastly important in this because you can prevent it as an adult. So a lot of kids are diagnosed with ADHD. A lot of times it's not ADHD, it's sleep apnea. Okay? One of the differences in screening sleep apnea in children and adults is that the children don't usually have that daytime tiredness that adults may. And again, I have to stress, everybody is a snowflake, everybody is different. So one patient may have tiredness, one patient may not have tiredness. Every patient is going to be different. One patient may snore, one patient may nasal. You know, you have to go to somebody like me that knows what to look for. Obviously, apnea is snoring. With children, it's about 1 to 10% of children have sleep apnea. About double that snore. So there's a pretty good chance if the kid snores, it doesn't have a cold or some issue like that, there's a good chance I do have some sleep apnea. Okay, so treatments for kids, none of which I do here, except for maybe orthodontics. We do have an orthodontist here. Adenoidectomy and tonsillectomy are the treatments of choice for children, not for adults, just for children. They can use nasal sprays if the patient has poor nasal breathing, especially in mild cases. If these surgeries do not work, CPAP, which is continued positive airway pressure. That's the mask that you probably all have heard about. That's the gold standard for treating sleep apnea. Basically, it's a mask that blows air down your airway and pushes everything out of the way to open up the airway. That's what CPAP is. So if that doesn't work, another procedure which we could do here with an orthodontist is rapid palatal expansion. So basically, if the child is a mouth breather, which is a huge issue, the whole palate forms differently. So what we could do at the childhood stage is we could expand the palate and open up the airway that way. Just want to talk a little bit about my mom. This is my mom. You know, she passed away when she was 73 years old. When she passed away, she was overweight. She had diabetes. She had high blood pressure. She had a condition chronic venous insufficiency. She had snoring. She had daytime tiredness. She had all the signs and symptoms of sleep apnea. But when you would go to a physician, especially back then, they didn't know what to look for at all. Even these days, as I say, they don't spend enough time looking at the condition itself. So I just cut out some pictures of some famous people that recently have passed away, all due to sleep apnea causes, not directly for sleep apnea, but perhaps the cardiovascular incident raised by it. And we all know about Carrie Fisher that just happened, last week. I think the results came in on her autopsy. There are other treatments for sleep apnea, but the two main treatments are CPAP and oral appliances. Everything else is additive treatments. Now, if the patient is overweight, weight loss can help a lot. Positional therapy, basically what this means is just don't sleep on your back. As I mentioned, 60% of sleep apnea patients are a lot worse when they sleep on their back, and if they just correct their sleep position, sometimes that can help in itself. Surgeries, basically, I just saw somebody, but if CPAP or oral appliance therapy is not effective, there are certain surgeries. They're not pleasant and they're kind of radical, so it's only a last-ditch effort. Also, a lot of these patients have poor nasal breathing, so we do our best to improve their nasal breathing whenever we can through different methods. We talked about this before. Okay, I just wanted to mention, just not to plug myself, but I will. I'm one of 5 diplomates of the American Academy of Dental Sleep Medicine in Manhattan. So there are not a lot of qualified people in Manhattan to treat with sleep apnea. Most dentists are not trained in sleep apnea or how to treat it, so I suggest if you know somebody that has it, you should bring in somebody that's qualified. Talk a little about CPAP for a little bit. Again, CPAP is known as the gold standard. More and more oral appliances are becoming a major option for this. We have found that patients that wear CPAP, they only wear it only about 50% of the time. So the compliance is very poor. There are different types of CPAP masks.
Yes, I just thought I can. Let's see here.
I just want to bring up a slide showing this relationship to many diseases out there. Most of these are cardiovascular, some are not. Talk a little about sleep disorder breathing. So patients can have snoring, they can have more loud snoring, they can have what we call upper airway resistance syndrome, or they can have mild, moderate, or severe sleep apnea. So there are different degrees of obstructions. Okay? As far as, I just want to discuss snoring, that's an obvious thing. Upper airway resistance syndrome is basically, when I mentioned apneas, hypopneas, it's neither. It's basically a patient that has some sort of obstruction, but it is not an apnea or hypopnea, but it is an obstruction. And it also could cause major problems, major tiredness. And again, the higher degree of sleep apnea, the more dangerous it is. We make oral appliances here. Basically what I do with an oral appliance, it fits on your top and bottom teeth. It enables you to sleep with your lower jaw forward. So what we do is, it brings your lower jaw forward, brings the tongue forward, opens up the airway. So we're mechanically opening up the airway by bringing the tongue forward. That's basically how it works. This is a very interesting biocompatible polymer that we use. It's computer generated. It's designed and manufactured by a computer. There are other designs and other models that I do use. Depends on the patient's teeth.
Can you wear that if you have Invisalign?
Can you wear with Invisalign, did you ask? There are appliances you can, actually. Not this one, but there's something called an Oasis appliance, which it could fit on the bottom Invisalign with clasps, and on the top, it doesn't actually even touch the teeth. It just is on the front. But it still advances the lower jaw. So yes, we can do it with Invisalign. We could also do this with dentures. So I try to find an answer no matter what the case is. You know, not everybody is a candidate, but most of the time we get it done. Certain patients I can't do it on if they're severe gaggers or a severe periodontal condition. Something like that could present a problem for doing this. There are other devices called tongue retaining devices, which could just hold your tongue out. It's not something I generally recommend, but you know, so we have to find a solution for problems. So this is basically a schematic of what actually happens when you're sleeping on your back. So this is normal breathing. You can see where the airway is, and you see the amount of opening there. And when the patient is sleeping on their back, that airway collapses and blocks the airway. And basically, when you stop breathing, you have that apnea, you're gasping for air. We talked about some of these before. I'm going to talk about a few more. There's something called hypoglossal nerve stimulation. Basically, that's equivalent to a pacemaker. So it's a surgical procedure where they put a pacemaker in your chest with a wire that innervates your tongue, and your tongue sticks out when you sleep. Sometimes you have to find solutions. This is a dangerous problem, and people ignore it, unfortunately, way too much. We talked about positional therapy, MMA surgery. I don't know if we have to get into that. That's a little complicated. These are all other types of surgeries. Some are more effective than others. Probably the most effective one is that MMA surgery, but very radical, very, very radical. That's only if it's basically life-threatening. So the model we here that we have at a holistic is basically we have the ability to do home sleep testing here. So basically we give you a home sleep test, you take it home, you bring it back the next day. We have a board-certified sleep physician read the sleep test, interpret it, and tell us the degree of sleep apnea with his recommendations. And then it's pre-authorized with the insurance company. This is covered under medical insurance, not dental. And we get the approval to do it. We also have the ability to do telemedicine. So my sleep physician that I use and I work with in another location, he could do e-visits. So you could go online with him and you can speak to him online. So you could have like an face-to-face office visit with a sleep physician. And he's actually very brilliant. Obesity in this country is a huge problem, and 70% of sleep apnea patients are overweight. Now the 30% that are not. So yeah, I have a lot of thin patients that are in perfect shape that have sleep apnea. But again, 70% are overweight, and we have found that if people overweight lose weight, it decreases their sleep apnea. So if they lose 10% of their weight, it can reduce their sleep apnea by 26%. So that's a huge factor. 10% weight gain increase, moderate, severe 6 times, increase apnea 32%. So weight is a huge issue. Obesity is a huge problem in this country. It's not going away. It is related to sleep apnea. And you know, as I say, I'm very happy to be working here where we have a great nutritionist that helps people keep in shape, eat well. McDonald's and things like that are just destroying our world. And you know, I hope you learned, and if you have any questions, I'm happy to answer anything. Yes? Not about acid reflux.
No. So I'm still not quite clear on the root cause, except for, I guess, if you're really overweight, then I suppose inside your esophagus it's thicker and so it's blocking the airway. But what about the other 30%?
Okay, so
why is it blocked?
Okay, so there are a lot of different reasons for that. There could be blockage in different places also. It may not be one source of blockage. So there are different parts of the airway. Like they call it the nasopharynx, the oropharynx, the hypopharynx. So it depends where the blockage is. Where we think the most, which is easiest to understand, is the tongue. So you're lying back, that tongue, especially if you have the big tongue.
The tongue is receding.
It goes back in the airway. But that's not the only thing. I could look at somebody's mouth and I see the shape of their palate and see if they're collapsible. So if you open your mouth, you know that uvula in the back of your mouth? So if you don't see the uvula, you know, you have a decent chance of possibly developing sleep apnea, just because of the shape of your mouth. So as I say, they're all different causes. Neck circumference, now you mentioned obesity, that has to do with neck circumference. So the larger the neck, the more chance of sleep apnea too. And that part has to do with fat, you know, around the airway. But again, there could be lots of different reasons for obstruction. So, you know, I mentioned just a couple.
No, the only reason I asked is because I realize there are some flaws with the human body, but you wouldn't necessarily expect 30% of people who aren't overweight. That's so being really overweight being a sign that things aren't quite working. But
Yeah.
then when you go to the other case, I guess I sort of believe that the body was designed to work pretty well. And do
Yeah.
animals have sleep apnea? You know, it's like what the
Only
heck?
the English bulldog is the only animal that has sleep apnea.
Uh-huh.
Basically because it's very flat face.
Uh-huh.
So the animal kingdom doesn't have sleep apnea, you know, in general. But with people, as I say, the shape of the airway, and it's genetic. As I say, if your father or your grandfather or your mother have sleep apnea, it's the shape of the airway.
Right, but that's also affected by whether you're breastfed and all of that too, right? I mean, if you're talking about the mouth.
That can have an effect also, yes. If it's obvious it's healthier to be breastfed.
Well, except we have a generation of people 30 and over who weren't breastfed, right? 35 and over.
Correct, yes.
From a holistic point of view, can essential oils help to improve this condition?
There are all sorts of other types of conditions, other types of treatments that have been suggested. As a doctor, you know, I go with what the studies have shown, and the studies have shown, you know, the data has not been in to indicate that to me alone to be a treatment.
Doctor,
Yes.
have you seen cases where people had 4 premolars extracted?
Yes. Yeah, so-
crowded dentition and collapsed back.
Yeah, so that I call that the size of the box. Basically, the larger the airway, the better. So in my generation, you know, a lot of times for orthodontics, they extracted the first bicuspids in either side, and they narrowed, actually that narrowed the maxilla, which also narrowed the airway. So I don't recommend that. We want to expand the airway. So these days we do maxillary expansion. We try to avoid extracting those bicuspids or any of those teeth that may shrink in the airway. Yes.
Yeah, I had a question. If you have allergies, or if you're in a really hot room, like in the summer, can you think it's sleep apnea, but it's just caused by that because you're allergic to something in the room, or it's just really hot in the room, you can't breathe?
Okay, so with allergies, again, that affects your nasal breathing usually, right? And that could affect sleep apnea.
But it's the cause of it, or it just adds to it? It's not
It
actually-
usually adds to it.
So in other words, you could think it's sleep apnea, but it's just an allergy. So if you get rid of the allergies to sleep apnea, what you think it is will go away.
Perhaps, but you want to be tested to make sure that's what it is. As I say, sleep apnea could be dangerous, so you want to let it go. You could blame it on allergies, but what if it isn't allergies? So I don't know 100%.
Like it's like really hot in the summertime.
Yes.
You know, you can't breathe because it's hot, and in the winter you don't have a problem.
Right. Well, that's true, but again, we don't know. We don't know if you have sleep apnea. You know, as I tell everybody, it's like doing blood pressure. You know, if a patient has high blood pressure, unless you put a blood pressure cuff on, you don't know if a patient has sleep apnea unless you do a sleep test. So the fact that it bothers you more in the summertime, okay, maybe you're right. It's just allergies. Maybe it's just the heat, but maybe it isn't. Maybe it's just showing more, you know, during the summertime.
So you can't know unless you get tested.
Yeah, I can't tell. Listen, I can guess. You know, when I look at a patient, you know, I ask them a lot of questions about daytime tiredness, you know, how they sleep, their sleep quality, if they sleep the night through, if they're waking unrefreshed or refreshed. So I ask all these questions. So I make a judgment, but I will never tell a patient they have sleep apnea unless they do a sleep test. So I don't know. You have to look at all the factors. So allergies can influence things, but again, you may have sleep apnea before the allergies. It may just worsen it.
Can you refer anything about sleep hygiene, like changing bedding or air quality monitoring?
Yeah, so as far as sleep hygiene, first of all, I think the most important thing is when you go to sleep, you should be ready to go to sleep. You don't watch TV and sleep. You don't play with the computer and sleep. You should be in a totally dark room. You should have no light. So, I mean, these are things you shouldn't drink before going to sleep, alcohol, or smoke before you go to sleep. Caffeine is bad before you go to sleep. So there are a lot of, actually I have a printed form. I don't know if any of the girls, are any of the girls here? Because I have a printed sleep hygiene form in the back if somebody wants to Get them? I don't know.
No girls or boys.
No. Anthony, can I bother you?
Thank you, Dr. Gross.
I'll try to get it. I do have a sleep hygiene form that I give to patients. I usually give this a lot to patients with insomnia because insomnia, obviously, they have a difficulty falling asleep. So I try to give them the best chance of getting that. I also say, when you go to bed, clear your brain. You know, if you have any things you have to do the next day, make a list of them on a piece of paper, you know, and just forget about them. So when you go to sleep, your brain should be clear. Be ready to go to sleep. Don't go to bed otherwise.
Could you address again the root cause of sleep apnea? Is it structural, that, like you said, there's not enough airway due to orthodontic or other issues like thumb sucking, or is it also other factors like you mentioned, nutrition? Is there a root cause?
It's all of the above. You know, there's sleep apnea can be caused for many different reasons. As I said, there's a lot of different causes of obstruction. What happens in childhood, whether it's thumb sucking or, you know, bicuspid extraction or mouth breathing, all of these things could affect the airway, the shape of the airway, the size of the airway. Obviously, the smaller the airway, the more chance of collapsibility. So, and, you know, obesity obviously is a big factor there. So there are a lot of different causes of it. That's why, you know, there's no surefire treatment for sleep apnea. We have to do therapies. CPAP, as I say, oral appliance. Oral appliance doesn't work all the time. It works most of the time, but doesn't work all the time. Why? Everybody's different. That obstruction may not be where we think it is, and unless you want to have some sort of endoscopy and, you know, with drug-induced sleep endoscopy to observe where the obstruction is, we don't know for sure. We're taking an educated bet that it's going to work. Anything else?
How else does it, I mean, with sleep apnea, you don't get enough oxygen in the brain. So how else does it affect the brain besides fatigue or depression?
Well, obviously fatigue is a big issue. There's a syndrome, I think, where you don't get sleep in kids, and these kids die. You need sleep. You know, you need sleep to function. You know, so this affects every cognitive skill that you have, whether it's learning skills, memory, everything. So there's nothing more important than sleep. You know, you just cannot survive without it. I mean, did I answer your question? Or?
Yeah, with the oxygen, not enough oxygen.
Well, obviously oxygen, I see that, and we see in patients, and in certain of these patients, they get very little oxygen. And they have to need supplemental oxygen. You know, so, and you know, you see this in medical conditions, if patients don't get oxygen, and it does totally mess up your brain. Anything else? Okay. Anna Maria?
Yeah, right here.
Okay, she's going to talk about nutrition and how to get you in better shape so you don't have sleep apnea. Here you go. Thank you very much.
Load my presentation here. Okay. Great. Hello, everyone. Again, my name is Anna Maria Pontes. I'm a registered dietitian nutritionist. I'm also the resident nutritionist here at Holistic Dentist. And today I will be talking about how to kick the sugar habit. So why is this topic important after an amazing talk that we just heard from sleep apnea, right? So as you heard it yourself, 70% of patients that actually suffer from sleep apnea, or individuals that suffer from it, they are overweight or obese. So if we actually correct the epidemic of obesity and help people to reduce their weight, we also indirectly helping people with sleep apnea, right? So if we get slimmer, we can sleep better, and because we can breathe better as well, and the windpipe will not be collapsed, something that I will get in a little bit. So how to kick the sugar habit? Pretty sweet, right? So hopefully you will get some insights out of it. I will be giving you recommendations. Don't worry about writing them down. Today you will be getting a bag, a to-go bag. And there's an envelope inside that has all the solutions that I'm giving to how to kick the sugar habit. So don't go crazy thinking, trying to memorize or to write it down on your phones. Relax. Just enjoy the talk, and it will be all there in your bag for you. So you are in the right place right here, right now, if you crave for sugar at a certain times. Yeah?
Yes.
Yeah? Raise your hands if you raise sugar at certain times of the day. Welcome, you are in the right place. You also here in the right place if you don't sleep well at night for whatever reason. Yeah? Welcome. You have sleep apnea, and you came because you wanted to hear about Dr. Feinbaum's presentation on sleep apnea. You suffer from it, you want to get solutions. You suffer from an inflammatory condition, perhaps diabetes, perhaps an autoimmune condition, and you hear because you heard from someone that actually eating more sugar can trigger inflammation in the body. And perhaps you have high triglyceride levels, which can also be increased by eating more sugar. So if anything of that resonates with you, sit tight, enjoy. We will be addressing all of that. What you will learn in today's talk, what sugar does in your body. Why we start and we cannot stop is actually addicting. What is sugar and the sleep connection? So I will make a connection why we actually tend to eat more sugar when we actually sleep deprived. And how to kick the sugar habit. So here's an image of the brain. On your right-hand side, you see where the part in the brain that is related to the pleasure highlights when you actually use cocaine. And if you see on the brain, on your left-hand side, is the same part that highlights when you eat a lot of sugar. So this is the pleasure place in your brain, and it gets the same, it gets highlighted equally when you eat sugar. So what this shows to us is that sugar is equally, if not even more addicted than actually cocaine, right? So this is the reward system. When you get something that brings you pleasure and that gets that rewarding, it highlights. And cocaine will do that, but also will do sugar. So that's one of the reasons that when you actually start eating, you can stop, because it will trigger that part of your brain that is related to reward, and you always wanted the reward. You had it this afternoon, you want it tomorrow again, and you want the next day. It's rewarding, right? And it's addicting too. So the biggest challenge that I have in my practice is on kicking the sugar habit is that no one wants to do it. And why? Simply because it feels damn good to eat sugar. We all want to eat sugar. It feels good, right? So when I consult clients on how to go around it, but it's something good, and how you go around something that is so delicious. Let's go over tonight. So this is the sugar addiction cycle. So stay with me here. Number one, you eat something sugary. You eat it because you like it, you crave for it, right? It's addictive. We just saw, we already established that. So the pleasure center in your brain will highlight is rewarding. You crave for it, you want more of it, you keep eating. When you do that, the sugar levels will spike up, what I call the sugar high. You're gonna go to that experience of being on a sugar high. You high on sugar. So you can see here, perhaps there's another slide, but just bear with me. The pink, kind of like a purple line here, is related to your sugar levels. So it will spike up in your bloodstream. And when you have too much sugar in your bloodstream, you feel that high sensation, right? So the blood sugar levels will spike up. Dopamine is released into the brain on that center that I showed to you that was highlighted in yellow. That equals to addiction. And with that, mass insulin will also be produced by your pancreas to go to your bloodstream to take care of the sugar that is high. When the insulin, that is the green one here, goes up, glucagon, which is the hormone that is responsible for making you to burn fat, actually stops working. So at this point right here, when the sugar and the insulin is high, you actually stopping to burn fat and you reserving fat. So that becomes an issue. So that's what it needs to be corrected, because at this point you actually retain weight, right? So after that, the blood sugar levels will fall rapidly. Do you see that it just fall? It went all the way down from being up. That is called the sugar crash. So you go high to then crash down. And this is the perfect example of a sugar roller coaster. When you go from high to crash down, and when you're down, what do you want?
More sugar.
You want more sugar. You want the high again, right? You want to go up. And then the cycle becomes vicious, right? So here again, the sugar levels will fall rapidly. Insulin levels will also cause immediate fat storage. And you want the high feeling again. Number 4 will come the hunger and cravings. You want to crave for the sensation of being high again. So low blood sugar levels being right here on the bottom will make that happen. Your appetite will increase. So not only you have the desire to eat for more sugar, the desire to be in the sugar high, but you actually physically hunger. So you actually feel the pain of feeling hunger plus the desire of eating sugar is a perfect combination for disaster, right? So that's what it happens, and then as I mentioned, it's a vicious cycle, so it goes on and on and on. So this is a better picture of your sugar roller coaster. So again, you here are hungry. You eat something that it has high intake of sugar. It goes high, so your sugar levels are high. And then to crash down, that's when the cravings happens. And you want more sugar. To eat another sugary food, sugar levels go up. To come down, up and down. When you're actually down here, it's not fun at all. You feel lethargic, you feel tired, you have brain fog, you cannot even think clearly. It's not fun. You've probably all been there. Like skipping a meal is a perfect example of that. You go long hours without eating and you just feel so tired to the point that you kind of cannot even think clearly anymore, right? And you get cranky, you get hungry, right? Like when you're hungry and angry at the same time. So this is not the perfect scenario. What we actually want is this green line here. This is a balanced eating that keeps your blood sugar levels stable all day. Do you see the difference here? You don't have the highs and you don't have the lows. This is the secret. That's it. This is what you came here for. This is how you curb your sugar habits. That's how you kick it. If you actually eat it to aim for balance, you don't get up, you don't go crashing down, you don't get the cravings for sugar. The vicious cycle is not repeated. So how to do that? Most sugary treats are low in fats and also low in fiber and protein. And they slow down sugar absorption. So what I'm trying to say here is that fiber, healthy fats, and protein will slow down sugar absorption to your body. It will send that sugar in a more slow, steadily manner to your bloodstream. So when you're having a balanced meal, this will happen, not this. And if this is happening in a constant manner, you're not having the sugar cravings. And if you're not having the sugar cravings, most likely you won't go for it. Does it make sense? Okay, good. So what's the sugar and sleep connection? Being overweight contributes to sleep apnea, right? I think we got that established. Dr. Feigenbaum spoke about it. There are studies that can back us up here. 70% of sleep apnea individuals are either overweight or obese. So overweight contributes to sleep apnea. Sleep apnea contributes to sugar cravings. So when you suffer from sleep apnea, you don't sleep well. You don't get much oxygenation to your body. You feel tired. You want something to pick you up. What we just established, that sugar will actually pick you up, right? Will bring you to the top of that roller coaster. So you want that. You're not getting that through your sleep. You're not getting a good quality of sleep. So you rely on sugar to bring that pleasure, to bring that reward, and to put you in a high position of the roller coaster where you feel invincible. You can't do anything. But you will crash, and that's when it becomes the issue. Then sugar cravings contributes to being overweight. Do you see how it's a vicious cycle too? Overweight contributes to sleep apnea, sugar cravings, overweight to sleep apnea. You got the picture, right? Sugar also is an excitatory food, so it makes you to crave more for sugar and impairs your sleeping. So if you have that sugary food in the morning for breakfast, then you're craving again for a snack, then perhaps you're craving for lunch, and you're craving for dinner. And sugar will actually keep you up at night. So if you're trying to go to bed in a reasonable hour, and you're having a sugary treat before bedtime, that sugar will actually keep you up, right? And then if you're up, you're not sleeping well. And if you're not sleeping well, you sleep deprived, obviously. And the next day, what do you want to keep you up? Sugar, because you want to be in the sugar high. Coffee is actually a great example too. We usually crave for either sugar and coffee, and sometimes both. They go hand in hand, right? It's nothing better than having a muffin with a cup of coffee or donut with coffee. So are those two the two foods that will actually pick you up? They go hand in hand. So I just said, poor quality of sleep will increase your sugar intake. It will take you to the sugar roller coaster trip, will increase your insulin, therefore will decrease your glucagon, which will make your body to store fat, will make you overweight, and eventually will increase your chances of sleep apnea. I'm not saying that every overweight person has sleep apnea, but it will certainly increase your chances too. Okay. So this is just a picture. I think we already saw that in the previous presentation. Here's the open airway. You can see the blue arrows is air. It's moving freely through the nose, through the mouth, to the windpipe. And here's a blocked airway. One of the reasons that this airway can be blocked is actually for extra fat tissue. So this is just a bigger picture of this part here only. As you see here, there's some fat in the yellow, some fat tissue. When you're overweight, you actually get more fat in your throat as well. So that's what doctor was saying when you have a larger neck circumference. So having that fat will actually, when you're sleeping, it can put more pressure and it can close the airways.
Actually, the studies show you actually get more fat in your tongue, believe it or not, so it's more collapsible even that way. Just the other point.
Of course, yeah, which would be right here. Like the fat in the tongue would be like right in this area. So you get from the neck, thank you, and you get also from the tongue. And both can actually weigh down and cause the collapsing of the windpipe. So by decreasing weight, you can actually take this pressure off and can be actually one of the solutions for the sleep apnea. Of course, we went over, there's different cases, you should go for the test, but if that's the case for you, let's work on that so you can start sleeping better and feeling better. Another reason of sleep apnea related to being overweight is that when you have a more visceral fat, which is the fat actually covering your midsection, right? All the organs in your midsection, will actually push the diaphragm up and will compress your lung. If it's compressing your lung, it's making the lung volume actually shorter. So you're actually receiving less of oxygen that can make you be more sleep deprived the next day. Low levels of energy and craving for more sugar to counterbalance that, right? You want something to pick you up. Also, excess fat compresses the chest itself and makes it difficult to inhale. So fat here on the chest can also compress the lungs. So fat in the back of the tongue, on the windpipe itself, on the lungs, and the diaphragm will compress this whole region here, will make it much more difficult to breathe. So by releasing the weight, you actually releasing the pressure that is being built up in that area as well. So what are your cravings saying, right? I want us to get solutions here to kick your sugar habit. But let's just talk a little bit about cravings. I tell to all my clients that cravings are actually a blessing. If you actually just sit quietly and you listen to it, you can get a lot of insights out of your cravings. So just give the opportunity to learn what your body is trying to tell you, right? So cravings can be a blessing, not the enemy. Is your body a way of telling you something? So just sit quietly and listen to it. Sometimes it's easier to reach for sugar than actually addressing or dealing with the problem in your life. So just think about that for a second, right? So sometimes as simple as dealing with the problem instead of going for a sugary treat to kind of forget about it, the problem's still going to be there. You're going to eat and you're still going to have to go back to it, right? So sometimes it's just addressing that. Let's address what you're craving for in life. That way you don't need to be relying on sugar so much, and then you won't put on weight, you won't compress your airways, you won't develop sleep apnea or all the other inflammatory conditions, as I spoke in the beginning, like diabetes or autoimmune conditions as well. The sugar is one of the main causes of it. Okay. Sugar is the easiest way out in constant stress. When we stress out, we always tend to go for sugar, right? Why is that? I established when we eat sugar, it highlights the pleasure center in our brain. So if we are stressed out, there's not much pleasure in there. We automatically want to go for something that gives a reward feeling and that is pleasurable. So it tends to be the easiest way out. Scientifically, it's actually impossible to release weight when you are in a stressful situation. So if you're so stressed out, you won't release the weight, and that will put you in the overweight, and that can increase your sleep apnea risk. I feel that I'm repeating myself with the connection, but it's important. That's exactly why I chose this topic for today. And people were actually even asking me, like, why are you talking about sugar if it's sleep apnea? Why can you give us recommendation about holistic alternative ways for sleep apnea? Because I feel the sugar is actually the most important one. If we're taking care of that, we're taking care of your sleep and many other things, and decreasing your chances of actually developing sleep apnea, right? That can be developed at any age. And I'm so much about preventing, so let's talk about it before it even actually happens, right?
Sorry, what do you mean by
Yeah.
scientifically impossible to release weight? Meaning you store fat if you're, what does that mean? If you're
Sure, I'd
stressed?
be glad to explain. So when you are stressed out, you have your central nervous system. There's two branches of your central nervous system. There's one that is called parasympathetic, that is responsible for rest, heal, and digest. And there's the sympathetic, that is the fight or flight. When you are stressed out, you're turning on the sympathetic, so you're always on a fight or flight state. When you are on that state, the parasympathetic is shut down. So you're not digesting food, you're not healing, you're not resting. If you're not digesting food, the food is just there and it's building up, as toxin is building up as extra energy. So I give you an example. Let's say that you're actually home and you're cooking, and you start a pipe just burst in your kitchen. Will you be like, oh, whatever, let me finish cooking, let the house flow? No, you will stop whatever you're doing and you will take care of that first, right? So the same thing happens to the body. The body is trying to do its normal function to keep balance, to keep health. But if you stress out the body, okay, let me stop everything here. Let's deal with that stress first. Then I start digesting. Then I go back to burning fat. But let's deal with the stress first. This is actually a defensive mechanism we hear as human beings because of that, and the evolutionary scale I'm talking. However, when that becomes the norm, it's not just one stress that you have once a month, it's every day, 24/7, it's scientifically impossible to actually drop weight because you have your sympathetic nervous system always on. This is being actually scientifically proven. So that's why I mentioned that sugar is the easiest way out to constant stress, and stress is scientifically impossible to reduce weight when you're in that stress state because of your nervous system. And the sugar roller coaster that we went over will impact your mood. Remember when I said you might feel so high up there, but when you crash, oh boy, you crash. And you're cranky. I've been there, and you don't want to be around me when I'm there. That's why, knowing that, I actually eat in a very certain hours. I make sure I have my healthy fats and fiber with all my meals, because when I go high it's fun, but coming down, you don't want to be around. And you probably experience that yourselves, right? So it will definitely impact your mood, will make you to put on weight, will also impact your sleep quality, and be a risk factor of some conditions, some diseases such as diabetes. So kicking the sugar habit without giving up sweetness. So I feel that you came here for solutions, right? And I'm blah, 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 giving you all the background of it, but I find it to be important. So let's jump into the solutions. And that's what I mentioned. No notes will all be in your handout. Solution number 1, drink a glass of water. Most likely, when you're craving for something, you're actually not hungry at all. You're not even craving for the thing that you're craving. You're thirsty. When you eat something, especially a sugary food, it requires more saliva to come actually to your mouth to digest whatever you're eating, right? Saliva has an enzyme that is called amylase that digests sugar. You eat something sugary, you need to produce more amylase. If you need to produce more amylase, more saliva is actually ejected into your mouth. Then you actually swallow your own saliva mixed with the food, and then your thirst go away, right? So you actually sometimes not even craving for the sweet, you're simply thirsty. So a very easy recommendation that I give to my clients is, you're craving for something, go and have a half to a full glass of water. Wait 5 minutes, 20 minutes, and ask yourself, am I still craving for that cheesecake? Most likely you will say no. And people are like, yeah, you're right. But it actually works, and I challenge you, I invite you all to do that. Next time you crave for something, go and drink half to a full glass of water and wait a certain time, 5 to 20 minutes, ask yourself the question, do I still crave for that food? And if you do, and if you make a conscious decision to have it, go and have it. But do that experiment. Shoot me an email, let me know how it goes. Solution number 2 is to satisfy your sweet tooth using actually natural sweet sugar coming from veggies, fruits, and also spices. So there's a lot of fruits there that are sweet. Most of our fruits are sweet, right? Some are a little sour, but most are sweet. So kick the sugar habit, but don't give up sweetness. You still can have the sweet flavor of in your life. But choose things that can also bring other nutrients along with it, right? For example, sweet potatoes is extremely sweet, but it will give you fiber. It's extremely high in vitamin A. Vitamin A is actually important to synthesize calcium in your body. Calcium is important for strong teeth and bones. So if you go for something sweet, go for something that will actually give you benefits for what you're investing to your health. Fruits, we went over. Spices. Spices add more flavor. I'm not from here, as you can all gather from my accent. I'm from Brazil, South America. It's very tropical, and we have a lot of spices, and we put a lot of flavor into our food. I spent some time in India, and they do the same in India. And I actually came to realize that the food in America is quite boring, and that's why we need a lot of sweet, because we want to compensate for having food that is tasteless. So add more spices to your food. You can add cinnamon, you can add cardamom, all spices that can add like a slightly sweet taste to it. And if you have that on a continual, frequently basis, most likely you won't need to go for the sweet because you're actually giving your body in a little bit during your normal eating habits. Solution number 3, sleep. I think we spoke about that. Sleep is the time that the body has to repair itself, to rejuvenate. If you're not sleeping well, you're not rejuvenating and will cut up to you, right? One night maybe you now sleep 5 hours and then 4, go back to 5. You're not catching up over the weekend. Your body's suffering from that. If you sleep deprived, you will reach for sugary foods because again, you want the sugar high. So sleep well. Another reason to sleep, as I mentioned, is the time that you have to rejuvenate. You bring more oxygenation to your body as well when you're sleeping and when you don't have any sleeping issues. That's why sleep apnea can be so harmful to the body and can be the leading cause to cardiovascular disease or diabetes because you're depriving your body of oxygen. And if you are, your body is paying a price for it, right? It's becoming more acidic, there's inflammation involved, and disease, again, just like cravings, is a blessing too because it's giving you signals that something has to change in your life, right? So pay attention to all those signals. Sleep well and avoid being sleep deprived. Solution number 4 is to check your protein intake, especially at breakfast. So why is that important? Remember I mentioned before to have the nice curve to the the sugar being sent to your bloodstream. You need fiber, you need protein, and you need healthy fats to all your meals. So when you eat protein, protein takes much longer than sugar to be digested. So when you're eating sugar with a protein or a carbohydrate with a protein, it will take longer to be digested. And if it takes longer, the sugar is not spiking up. Especially in the morning, because it's when you're starting your day. You don't want to start your day already with the wrong foot, right? Starting already having some sugary things, and then it goes the morning snack of sugar again and lunch sugar. Let's start in the right way. Let's start with a protein. It will make you more satiated for a longer period of time. Will also make you more focused and alert. Who doesn't want to be focused and alert, especially in the morning, right? You go to the office, you get things done, you go to work, you take care of your family, you actually have energy to do that. So that's solution number 4. Solution number 5 is sniff out low-fat and fat-free foods. Fat will not make you fat. Choose the right fats. There's the unhealthy ones and the healthy ones. Let's concentrate on the healthy ones. When you get something that is fat-free, they remove the fat. Guess what they will put in place? Sugar. You got it. So that will feed off your sugar habit. So actually eat fat instead of eating the sugar. Because as I mentioned, fat will take longer to digest, will keep you more satiated, will not bring you high in the roller coaster, therefore it's not going to send you down. Okay? If you have questions, what is a healthy fat, what is an unhealthy one, come here, schedule a session with me, and we go over it all. Solution number 6, move yourself. It's New York City. The city was actually designed, or if it was not, correct me, but I think it was, I like to think this way, that it was designed for us to walk a lot, right? There's subways in pretty much every corner, so you can hop in a subway, you can get off, you can walk to your destination, walk back. Sometimes it's when it's weather permitting, I will say get off in a station before your destination, walk to one station after where you have to go back home, walk more. Explore New York City. Sometimes just walk from one neighborhood to another. Just walk. Just do the dog walk. Do you know the dog walk? Like walking your dog when the dog has to stop in like every single corner to observe the grass, to observe. Do that. You know, be more mindful about it. Don't take things for granted. Go walk and take a look on the tree. Sometimes there's not even trees in New York. Count like, oh, 2 blocks I actually saw one tree. Oh, 3 blocks I saw another one. I saw this, I saw that. You will be impressed how much fun you can actually have it. And this is another way to kick the sugar habit. The more active you are, the less sugar you will actually need coming from highly processed foods. Why? Because being active will bring more oxygen to the body. Having your body being more oxygenated will give you the high naturally. You won't need to rely on sugar. Number 7, create a new post-meal rituals. I feel that most people go for sugary treats between meals or after meals, like a dessert kind of thing. So change that, create a different one. And I suggest to be perhaps a cup of tea. So you eat something, you have that craving for something sweet. Remember what I said, that perhaps you're dehydrated and you're actually thirsty. So have a cup of tea. There's so many herbs that you can actually put in your tea that will give a little bit of that sweetness, like licorice is one that is actually extremely sweet. Ginger is also highly digestive. So not only you curbing your sweet craving, but you adding some herbs that can actually improve your digestion. So now I will invite you to take action. And I would like to know, we can gather a little bit after this, which one of those 7 solutions you actually will take and put in your life for the next 7 days to come. Right? So I'm not telling for the rest of your life, it's too long, because I do hope that you guys live a long and healthy life. But for the next 7 days only, pick one and you will be like, you know what? I will move more. I will drink more water. I will perhaps sleep better. Make sure by 10 p.m. I'm in bed, whatever it is. Let me know what it is. So what now? It's been a rough day. I gave you a lot of information. Will you use the information that was given to you? Useful information does not equal to lasting transformation. What you know doesn't necessarily mean that you're going to do what you know. Most clients that I work with, they have a fairly good idea of 1 or 2 things, if not 10 things, that they could do in their lives to improve their health. They still not doing. Right? That's what I became more curious about. So how many people do what they do? How many people know what to do but don't always do it? That's because knowing is not enough. Knowing actually doesn't motivate us to act. So what do we need to make this time different? There's 3 ingredients for this recipe here that I'm presenting to you. And they are the right system, the right support, and the right accountability. And I can provide all of that to you. I gave you 7 solutions for you to take home and do it. And if you do it, and you feel super self-confident to do it, and you feel improvements in your life, great. Call me, let's chat about it. I want to be there clapping your success. But you still have 7 solutions. If you still cannot put those 7 solutions in your life, I want you to work with me. Because I will give you the system to put those solutions in place. I will give you the support and I will give you the accountability. So let's make this time different. I will invite you today, you present here, to a 90-day transformation program discovery session. What does that mean? It's a 40-minute long consultation. So I ask for you to invest 45 minutes of your time to have a one-on-one assessment with me that I call the discovery session. In this session, you will discover what your craving means, what your cravings mean. Remember when I said there's always a message there? Let's together find out what the particular craving that you have actually mean. How you are stuck and how to get unstuck. If you feel stuck in your life and your healthy habits, let's get unstuck. And I can give you the right system, the right support, and the right accountability to make that happen. And a plan of action to experience total transformation. So all that I ask from you today is 45 minutes of your time On the bag that you will be receiving will be a form there. This opportunity is on the table just for today. It's an $80 value session, 45 minutes of my time with you. It's there in the bag. You fill it up, I contact you, we schedule a time here to go over this discovery. And I appreciate your time so far. Thank you. If you have any questions, please let me know. Thank you. Let me grab the bags. Yeah, let me grab the bags then.